Hello, I'm Charles Masarski. I'm a doctor of chiropractic in Vienna, Virginia, in the Virginia suburbs of Washington, D.C. Thank you for tuning in. So, when we look for something to adjust, what exactly are we looking for? We are looking for subluxations, which are misaligned or restricted joints that disrupt nerve function. There are several ways to not find subluxations. For example, if the patient tells us to adjust the place where it hurts, it's right over here, doc. That may seem logical, but is often wrong. Never assume the location of the pain is the location of its cause. Very important tip. Do not wrestle the chiropractor's hand to show them where to adjust. Another excellent way to not find subluxations. Sometimes the patient will say, "Don't bother with that spot, doc. It doesn't hurt." The fact of the matter is, subluxation can cause problems that are not painful. It might not be pain, it might be numbness, it might be a problem with coordination, it might be a problem with balance. Absence of pain is not absence of cause. Muscles are more than pieces of machinery. The tone of a muscle depends on the nerve circuitry controlling it. That makes muscle function a very important factor in locating subluxation. We often assess muscle circuitry by testing the ability of a patient to hold a position against the examiner's force. That is called manual muscle testing. This often helps us locate a subluxation. To give you a specific example, if your ability to control the biceps muscle of your arm is significantly impaired on one or both sides, this may point to a mid-cervical subluxation, which would be located in the middle of your neck. Interference with the mid-cervical nerves can disturb coordination of biceps tone. When we were in chiropractic college, we were encouraged to practice finding a single human hair under a sheet of paper. When that became easy, we were to try 2 sheets, then 3 sheets, and so on. The idea of this exercise was to sharpen our sense of touch, to enhance our ability to assess our patients. An examiner's use of the sense of touch to gain clinical information is called palpation. In chiropractic palpation, the examiner is often searching for asymmetries in tone relatable to nerve dysfunction. For example, is there a left right difference in the tone of the muscle tissue next to a vertebra? Can the chiropractor sense a vertebra resisting movement in a particular direction? Is there a left right asymmetry in temperature adjacent to a vertebra? So, palpation, like many things in chiropractic, is all about tone. In our practice, we have developed new methods of palpation, which we find useful in selected patients. For example, the muscles between the ribs, which are called intercostal muscles, contract during phases of respiration. Asymmetrical contraction during palpation as the patient breathes in or out can make subluxation easier to find. By describing our new techniques in published papers, we are able to share these options with our colleagues for the benefit of chiropractic patients everywhere. If you are interested in one of those papers, the link for the full text is right there below. In our practice, palpation and manual muscle testing, which we've just discussed, are routine assessments before a chiropractic adjustment. Sometimes we want more information. One assessment technique takes advantage of the fact that your skin is loaded with nerve endings that allow you to perceive light touch, deep pressure, heat, cold, and vibration. An area of skin in which these nerve endings are connected to one particular spinal nerve is called a dermatome. A dermatome map resembles a mosaic, as you see right here. To give you a specific example, if the patient can feel a small brush moving lightly over the left thumb, but unable to feel it clearly over the right thumb, the examiner would suspect a possible subluxation involving the sixth cervical vertebra in the neck. If the vibration of a tuning fork could be clearly felt on the left small toe, but not the right, the examiner would suspect a problem with the lowest lumbar vertebra in the low back or the sacrum in the pelvis. As with palpation, vibration sense being one of the most sensitive indicators of dermatome function, our practice has developed innovative ways to test vibration sense using one of the most common diagnostic instruments, the tuning fork. As with our palpation methods, we share these techniques with our colleagues through publication. You see a link to one of those papers on this panel. All of our published papers can be assessed at our website. Click on About the Doctors and scroll down. Not all patients are the same. Therefore, chiropractic assessment often needs to be individually tailored to the patient's clinical situation. For some examples of this individually tailored assessment, watch our informative and entertaining video, Mohs Concussion. Go to our website and select YouTube. For further information about this or chiropractic in general, visit our website. For appointment information, please call 703 938 6441. If you do not live in Northern Virginia or anywhere in the Washington, D.C. area, call us anyway. We will try to locate a practitioner close to you. Please share this video with someone who needs to see it, and thank you so much for your attention.